Okay, a major Donald Trump campaign promise was actually something that is a longstanding Democratic pledge, which is let Medicare negotiate bulk discounts when it comes to the prices it pays for prescription drugs. Well, that's not going to happen. Another bamboozling by Donald Trump. Yesterday, Donald Trump met with pharmaceutical industry lobbyists and executives, and all of a sudden, Trump comes out of that meeting, and the plan to negotiate drug prices down has disappeared. What's the new plan? Lower taxes and get rid of regulations. Shocked. I am shocked that once again Trump's plan has changed from something that sounded vaguely good for consumers to the standard crony capitalist trickle down nonsense that helps big corporations and their executives. Most countries that have national health care, and by that I mean most countries at our level of development other than the United States, do this, right? They negotiate better deals on drug prices to include them nationally in their healthcare system. And manufacturing pills is so cheap that it's usually still very profitable for big pharma. We don't have a national healthcare system, but we do have Medicare for seniors, and it's a really big country. So negotiating makes sense. However, there's a 2003 law written by congressional Republicans, signed onto by our old buddy, George W. Bush, and it prohibits the federal government from using that negotiating power. And as recently as January 11th, Trump was ready to revisit the policy and get the negotiation going. Here's what Donald Trump said during a press conference on January 11th. Pharma has a lot of lobbies, a lot of lobbyists, and a lot of power. And there's very little bidding on drugs. We're the largest buyer of drugs in the world, and yet we don't bid properly. Agreed, completely. So let's negotiate. However, Donald Trump met yesterday with pharma lobbyists and pharma executives, and he comes out of the meeting, and what's the new policy for Trump? Take a look at this. Quote, I'll oppose anything that makes it harder for smaller, younger companies to take the risk of bringing their product to a vibrantly competitive market. That includes price fixing by the biggest dog in the market, Medicare. Before it was negotiating for Medicare. Now it's price fixing by Medicare, which is what's happening, Trump went on to say. But we can increase competition and bidding wars big time. So what I want, we have to get lower prices. We have to get even better innovation. And I want you to move your companies back into the United States, and I want you to manufacture in the United States. We're going to be lowering taxes. We're going to be getting rid of regulations that are unnecessary. Key points here. Price fixing by Medicare. In other words, Medicare working to keep prices low. He used to be for that via negotiation. Now he's against it. And of course, the new solution is lower taxes and get rid of regulations, which of course is a way for what? For big pharma to increase their profit margin with absolutely no requirement to pass on the savings to consumers. Does anybody get what's going on here, Pat? On most of the big public policy issues of the day, Trump started out with seemingly populist rhetoric, but he's coming back to the standard establishment Republican trickle-down nonsense every single time.
Yeah, it's really too bad. He campaigned as a populist, and you see more and more now he's taking on the positions of more establishment Republicans. It's obvious that Reince Priebus is in his ear.
Oh, yeah.
And he also promised that he wasn't going to touch Medicare. He wasn't going to touch Social Security.
Sure.
So we have to keep them to that.
It's another way, another example of Trump changing his mind to whatever someone told him 5 minutes ago. In this case, in the literal sense, he went in and met with big pharma lobbyists and executives, and 5 minutes later he comes out, he has a totally new position on negotiating drug prices. Make America great again? How does this help the average person? How does this help a lower income, a lower middle class person, a middle class person to afford medications? It doesn't. It doesn't. Discuss this with us on Reddit, davidpakman.com/REDDIT. Today's episode is made possible in part by menswear line Indochino. I often had a problem buying off-the-rack suits and blazers because I sort of have an oddly shaped body, I guess is the point I'm getting at. I would start with a 38, but that was just too big. I would try the 38 short, which fit a little better, but because of my absurdly long arms, which many people often point out to me, I then had a problem because the arm length, the sleeve length was too short. Not a problem when I went to the Boston Indochino showroom and worked with Chris there, who walked me through selecting everything from the fabric to the button style to the lapels and the lining and everything of my suit. And 4 weeks later, I had a custom suit specifically made for me, which was really, really great. If you can't get to one of Indochino's 9 North American showrooms and work with somebody like I worked with Chris at the Boston showroom, you can go to the Indochino website, and it will explain to you how to take all the body measurements that are necessary to get a great fitting custom suit. You plug them in, make your selections, and 4 weeks later, you've got a custom suit right there, ready to wear. This week, David Pakman Show viewers and listeners can get any premium Indochino suit for $389 at Indochino.com, but you must enter the coupon code Pakman at checkout. That's Pakman. 50% off the regular price for a made-to-measure premium suit. Shipping is free. Indochino.com, promo code Pakman, any premium suit, $389 plus free shipping. I love my Indochino suit. Check it out.